Hi, everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Tuesday, January 5th, 2021. Welcome to the new year, everyone. So, of course, with the holiday weeks, this last week, we are going to have inaccurate numbers for some time still. Worldwide, the number of cases confirmed passed 85 million. Roughly 4.2 million additional cases this week. Again, we are about up to where we were in terms of new cases per week per day as we were before the holidays. So we may be starting to pull out of the data hole that the holidays left us in. We'll look more at that in a moment. Here in the United States, we had about 1.5 million additional reported cases, which is probably a little less than it really is right now, as we'll discuss. Here in Massachusetts, 36,000 cases were reported. Worldwide, we saw about 80,000 additional deaths reported. In the United States, about 20,000. And Massachusetts, we had a bunch of backlogs, so the actual number from last week is pretty inaccurate. We have crossed 12,500 deaths here in the state. So looking at this graphically with the COVID tracking projects graphs here, so you can see in the daily cases and the daily deaths how there's that big hole from the holidays. Hospitalization has, as always, been basically the only number that is not significantly affected by holidays, and that's what we're going to have to draw a lot of our guesses as to how bad things are right now. We are, of course, at record numbers for hospitalizations and continuing to rise. But just looking quickly at these various metrics and how the holidays have affected them. So this is testing over time. This is the number of tests administered per day, with the line there being the 7-day average of number of tests given. And this shows all the significant holiday drop-offs that we saw there. So there was a slight bump there for Labor Day when we first noticed this effect. Any earlier holidays, we probably didn't see as much because our testing apparatus was still ramping up so much that it didn't really have as much of an effect. But then the significant Thanksgiving drop-off and then Christmas, we still have not recovered from in terms of the actual number of tests administered. So with that said, that testing is significantly lower than it has been, anytime since mid-November, perhaps even a little lower because we've got a couple of backlogs in there skewing things. New cases are already back where they were before the holidays. So here we see we went through the drop there following Christmas and into New Year's, and we had some backlog numbers as well reported there, but the 7-day average is basically where it was, so we may continue to see a significant spike there. Now there will be some larger days like this one outlier here sticking up on the right, when that is a lot of backlog cases get reported, but we may expect to see a continued upward trend as we saw after Thanksgiving. Although notably, we did not get quite the massive spike we were afraid of. However, there is still a significant uptick there. It's just continuing on to the trajectory it was already on. And when it comes to deaths, we have a similar issue. There was, that significant jump following Thanksgiving there, but we have not yet got back to the place where we were at. Death reporting takes a long time. So we should expect to see some spikes next week with a lot of backlog cases, and maybe a little while before we actually know what the current death rate in the country is. Hospitalizations remaining the one kind of steadfast metric, because hospitals are going to be open 24/7, 365 and a quarter days per year. But as you can see, the significant jump there is in the south, as cases or hospitalizations can rise significantly there, also rise in the west. Here in the northeast, they have somewhat plateaued. The last 2 weeks, there's not been significant uptick, at least not compared to the 2 weeks previous. And Midwest is continuing to decline, fortunately. Just looking back at 2020 as a whole, any single week in December was worse than any other week in the pandemic. Here, this just shows week by week breakdowns of all numbers here. So even the last week of December with the reporting significantly lower was worse than any other week. We have far surpassed our numbers from regional spikes in hospitalizations and deaths, especially there. This is that worst part in April when everything was so bad in New York, and now we're well past that. So we're not in a great place looking forward into the new year. And so let's talk about some of the developments that are happening right now. First up, the vaccination campaign is continuing. Approximately 13 million vaccines have been given worldwide, about 4.6 million in the United States, and around 110,000 here in Massachusetts. Now, this is a much slower pace than had been projected. Initially, there was talk that we were hoping to give 20 million vaccines in the United States by the end of December. We're less than a quarter of the way there. We've only even distributed 15 million vaccines. And there's just a significant slowdown of the rollout. This is a lot of fingers getting pointed in all directions. Federal authorities are blaming state and local authorities who are pointing fingers back up and at each other. There's also probably the issue that just the logistics of this are very complicated because it's not just a mass vaccination campaign where anyone get it, but also trying to keep the vaccine in these tiers that we're doing with healthcare workers and seniors getting the first batches. You can't just throw them out and let people line up, although some places they are letting people line up and it's not ending well. There's been reports of places where clinics are opening up and people are lining up starting at 3 a.m. the morning before they open, and the vaccine center is running out by 10 a.m. So it's going to be very difficult, and getting this program running properly is going to take some time. Also, the AstraZeneca / University of Oxford vaccine is now being deployed in Europe. It was a vaccine that we probably will not see a lot of in the United States. It is manufactured in Europe, but also the sort of fumbled results of the phase 3 trials did not play well with regulators here in the United States or independent scientists. So it's likely to take some time to get approval here. However, it has been approved in both Europe and India, where it is now rolling out. One of the major advantages of AstraZeneca's vaccine is that it is a lot cheaper and more shelf stable than the ones that we're currently using, so it does not require the cooling facilities that the ones we're using. So that makes it a lot more convenient. However, there is a lot of skepticism in the United States about its efficacy due to the unclear results of the phase 3 trials. Also, India has approved its own vaccine, actually skipping ahead of the end of their phase 3 trials. So the full data is not out on it yet. There's in fact very little data on it. And this is causing some political controversy over there as people are accusing the government of speeding up the vaccine approval process before they actually know anything as a political move to support the government's public health measures. Which is, of course, something we have unfortunately, we have no bearing on that here in the United States whatsoever. Also, though, with the vaccine distribution issues, shortages, and of course, the continued spread of the B.1.1.7 variant, which is thought to be somewhere between 10 and 60% more transmissible than the stock COVID-19. There has been some debate about how to distribute the vaccines and going through some alternative strategies, which include things like giving people just a first dose and just we're waiting until more dose available instead of saving the second dose for when people are ready. So this has the risk that people might not get the second dose at all. Alternatively, people are trying to maybe push out the second dose further to make the stock they have last longer, or even getting the second dose from a different vaccine project than they got the first one. So if we're getting Pfizer for the first dose and AstraZeneca for the second dose, this is a big controversy. Some people saying this is a bad idea. We don't know how effective any of these strategies will be in long term. People saying like, well, we don't have the vaccines, so we need to. And other people pointing out, it's like, well, okay, if instead of saving the second dose, reserving it for the person who got the first dose, giving it all as first doses to cover more people, well, we're not vaccinating fast enough for that to be helpful. So this continued debate. We'll see more of this in the coming weeks and see if any new directions come out of this. Just looking at where vaccines stand in the world. So there are 10 projects that are in use right now in either early use, and 3 that have received approval somewhere in the world. Those distinctions can be kind of academic because a lot of places, the early use or emergency use is effectively authorization, but has a couple more steps, and we are giving it out and plan to give it out to millions of people. But there are still many more vaccines in the pipeline after these, with 20 projects in phase 3 and many more still in the earlier clinical stages that will be coming out later this year. And you can find the sources for this update on covidtracking.com for all those lovely graphs, New York Times for the raw numbers, and mass.gov for Massachusetts-based data. One final thought for anyone who's lucky enough to be getting the vaccine soon and thinking about what you'll do after you get the vaccine. Well, the first thing I'm going to do after I get the vaccine is definitely make a bunch of spike proteins and engulf them with dendritic cells, and then I'll probably display the antigens to my T cells. Comic here from Massachusetts cartoonist Randall Monroe for XKCD. And for more of the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.